right, well, so we are looking at the third of our talks. Now we're going to look at the three phases of creative resiliency. And so as we begin to look at this, the first phase is going to be about getting our ideas into context. Second, we're going to have those ideas be powerfully differentiated. And then finally, those ideas are going to be told inside of playful stories. So these are the three phases that we're going to be looking at, and now we'll take each one of them one at a time, and then at the end of it, we'll try to show how these all come together with some of the things we looked at when we were together on day one and day two, as we looked at the higher level of the diagnosing innovation. So in phase one, first thing we have to do, we have to get ideas out of our skulls. So when that happens initially, it might be not as much detail as you would think. You can think of it as like sort of a little strand, just a little thread of an idea coming out. Over time, that will get to be something bigger. Maybe you get a little more dimension into it. Now we're showing it more like a tape that's coming out. And then the goal is you really want to get to fully formed ideas, big three-dimensional objects, and you want to have those coming out. Finally, we want to see those ideas in Technicolor with crazy shapes and forms and all kinds of different structure. And you can see they're showing that it's on like an assembly line, that you've really mastered the process. If you think about our idea going from, we talked about awareness to gaining mastery, that guided mastery we talked about when we kind of, took a peek at the Stanford D School. So that's what we're looking for here. We want to get proficient in getting ideas out and forming them really fully and completely, and then just like a conveyor belt, having that process for bringing those ideas out repeatedly. So as you begin to look back at this and you see when you're getting feedback, we talked about the looping ranch already. So as the looping you're sipping your coffee around the campfire at the looping reflecting on your day, you want to have a process that's going to be able to take that feedback, put it back in, and then come out, run the conveyor. Big, meaty ideas are coming out every single time. So first step, we've got to get ideas out of our head. The other thing that's really helpful is that it allows you to begin to look at context. And context is super important. This is the family tree. So in our family tree, we have grandparents, parents, and we have other kids. So the grandparents, that's the base of the tree, that big stout base that holds up everything in that tree. You can think about this as being those, the large companies that are inside the regulated industries. They've been there for a long time. They've got a root system. That root system feeds the trunk and then supports the rest of the tree. So a lot of times this could be companies that were around a long time ago, or research that was done a long time ago. So when we think about grandparents, this is the stuff that's old. This would be, expired prior art. This would be old papers. It would be, everybody relies on all the work that was done during the Apollo program in the 60s, but nobody even thinks about going back and giving NASA a nickel because that was 50 years ago. It was a long time ago. So, this is the stuff we're looking. When we look at this is that basis that everybody uses, that we all benefit from, and it's just, the shoulders of the giants that we stand on. It helps everybody because we all need that basic information that's out there, and then everybody uses them. The next one are the parents. Now, the parents are those big living branches that are up inside the tree. They're now reaching out, and these branches are very much alive, and there is new growth happening. They are also very strong. But these plants, your parents, when you think about this, these are the ones that, if you were to cut that branch, it's got some sap in it. And it can be holding up a lot of things. And so you also want to know, who else is out there? What are these other big branches that maybe you need to avoid? Or maybe these are branches you want to climb out on, but you need to understand who's controlling that branch. And finally, the smallest of them, and maybe the most numerous of them, because we don't really know, just like little kids, we don't really know what they're thinking or where they are or what they're actually doing. But the other kids, they're like those little spriglets. They're some of the smaller leaves, the littler branches, the ones that are kind of hanging out there, maybe just a little bit of new growth or a couple of nubs. We don't know if anything's really going to come of them. And they represent a lot of the startups that are out there. So with this family tree, I want you to begin to have an image of where your idea is going to live. It's going to be around one or more of these trees. depending on how many different areas of technology that your product or your innovation is going to interact with, you may have to understand one or more trees in, say, a grove of trees that are related to your technology. So if you can keep that in mind, that grandparents are the old things that are out there, everybody needs them, everybody relies on them. The parents are those big branches, they're still large companies. A lot of them are still very active in this space. They may have lots of intellectual property you'll have to handle. And then the other smaller branches are going to be people just like you, still under the radar. Nobody really knows what you're doing. Frankly, you're not really sure what you're doing yet. And you're just out there kind of growing, maybe testing, looking around, seeing where things are. So that's our family tree: grandparents, parents, and then the other kids. And then remember back when we talked about Kipling. We had Kipling and his 6 honest serving men. We talked about Aquinas and his how and why, and using those pairings of questions. That's another way to look at the family tree. Once you begin to get oriented, who's out there, what's old, what's new, and what's next, that's another way to think of those. What's old, what's new, and what's next. Think about asking those same questions from Kipling. So put those Kipling questions in. Get your, have your 6 honest serving men climb up that tree with you and question what's going on. How was that technology being used, back in the beginning? How has it changed now? What were those new things that happened? And then finally, we talked about, when we were gonna zero in and we were gonna tell a story to an ending, even if there are gaps. If you think back when we talked about the habits, that habit of zeroing in, we're going to do the same thing here. Just take a flyer on it. I don't know, I've got a device. Great. Climb the tree thinking you have a device. Look for all the ways that you will describe your device and try to do that. And you may find out that there are details in there about how you use it or what the features are that you have in it change radically some clinical scenario. Wow, well, wait a minute. You know what, Ben? I came down out of the tree. I realized I have a method. So now, climb the tree again, but say, now I've got a method. I've got a method of solving some clinical scenario that's very different. Now, it turns out the reason it's different is because of the device that you've designed, but it could be that change, that fundamental shift in the way that surgical procedure is carried out, that could be just as valuable as the device itself. And both can be protected and both will be important. So, final note here, climb the tree. You got to do the work. You can't get an arborist to come in and do it for you. You can't have somebody else go up the tree and then come down and try to describe the branches to you. This is work you need to do yourself. Believe me, it will pay off down the road. It will make you much more confident, or importantly, show you that what you're working on or what you thought was like the next big thing actually exists with another company. And then you can just ask yourself, do I want to go and try to come up with something that's marginally different, or maybe I should approach that company and just talk to them? Who knows? Maybe they'll say, you know what, this is great. We were hoping somebody would come along and maybe help us with that project, or maybe allow you to take it outside of the company and work on it and then come back to them. You never know how these things are going to work out, but you really want to know what else is out there so you know what you're contending with. So this second phase is we've got to climb our family tree and we've got to really get that context. And then the last one, this phase is the grilled yabbit. So now you've got to grill the yabbit. I know it is a lot of work. It's a lot of work. You're getting things out of your head. You're climbing trees. You've now worked up an appetite. You've also got a whole lot of stuff that you've looked at from grandparents, parents, and other kids. You're probably feeling a little overwhelmed. So why not grill up the yabbit? And the grilled yabbit, this is how you think about the yabbit. So it's that thing that is the difference. And here's how it ends up playing out. Let's say you climbed the tree, you came down, we're sitting there, I'm over at the grill, I've already got the charcoal on there, so the grill is nice and hot. We throw the yabbit steak on. And now I ask them, so what did you find? And maybe I was up there with you. So let's go back to our gallbladder. Remember we talked about pacing the gallbladder. We didn't have a reason why, but we've got some great technology in that. And I'd say, well, you know what? When I was up there, I saw, there was this one piece of art and they talked about pacing and they said, oh, it could be in other organs. So not just the heart, it could be in other organs. And so I don't really think there's anything to the gallbladder. And you'd say, yeah, but Ben, we think that there's something really particular about the gallbladder because it's not pacing like the heart. Oh, well, that's interesting. Well, there was another one that said that pacing could be done for different reasons. So clearly that wouldn't be enough either. Yeah, but Ben, we're pacing because we want to generate the excretion of a gland related to the organ. So it's not really the organ itself. Oh, all right. So then we turn the yabbit over and we continue in the same way. So it's kind of a gag, just to help you remember that when you find something that seems close, use the yabbit stake. Yeah, but. Yeah, but. So we acknowledge that yeah is yes, I get it. We're in the same area. Yes, we're both pacing organs. But the gallbladder is fundamentally different from the heart. The gallbladder, if you stop the gallbladder, it doesn't kill you. So right there, that one difference alone, you could talk about pacing irregularly, pacing twice a day, pacing one time in every 36 hours. And I can guarantee you, without even looking, if we were actually working on this, with that distinction alone, you would have eliminated every single piece of prior art related to anybody who actually wanted to have a working cardiac pacing system. Well, why is that? How could I be so outrageous as to make such a claim? If you didn't pace the heart but once every 36 hours, that person would be dead. The reason these people are getting their heart paced is because they can't do it by themselves. So that's what happens when you grill the yabbit. You begin to find these distinctions because it will hit you. You'll see that, oh, I've got nothing. Okay, maybe. That's why you grill the yabbit. And here's the other one to remember. That is a grill. I intentionally put in like this is an old Weber grill. So it's not gas. It's not a microwave. And there's no drive-through, no carry-out, no Uber driver, Uber Eats is going to bring this over to you. Again, like climbing the tree, this is work that you must do. So charcoal takes a long time to get hot. I recognize that. You're going to have to sit with these things for a while. And you don't want to rush it, and you can't offload it to someone else. So that's what we want to do. So we have to wait for the fire. It's going to be slow heating. This is not going to be like a microwave. You might have some things that are going to pop pretty quick, but most of the time this is really, really deep work. And then this is something that you must do yourself. Again, like climbing the tree, this is also work that as you get crystal clear about what this is and what you've done, how, what these distinctions are, because this is where you get into the details. You start pushing against something, these details will begin to bubble up. No one else can do that. This is actually a deeper part of getting ideas out of your head. Now that you know additional details that matter, you want to get those out too. So remember, this is a slow and deliberate process. You're heating up your idea. You're adding that heat and beginning to look at it more closely. And you're doing this now that you've got this heightened awareness of the grandparents, the parents, and the other kids. So this is the time to gather those distinctions. Define it. Yabbit, yabbit, yabbit as many times as you can, and don't be afraid of this step. This is probably one of the most important steps because the more of these that you understand, the better you distinguish your idea over everything you can find. Think of the confidence that you'll have. You're pitching to that VC. You've really got to land this meeting because this is, if you win this, they are going to lead your A round. And that's going to be it, because if they're there, you know they're going to bring in a consortium, and that's going to be your A round. You've got to nail it. But you know there's somebody in there that's really an expert in the space. Now imagine that. You know as much as that person that's in there. Why? That person lived in the industry. You studied the industry. That person knows what the people in that industry were doing. You know what all those people wrote about. But here's the key. The person that's on that VC board doesn't know your idea as well as you do. So as those questions come up, you have already done this exercise. Each time you're asked a question, and likely if you've done this well and you really climbed the tree and did it well, the probability that that person is going to say something that you have not either looked at explicitly or cannot, because you've done this exercise, have the skills to come back and say, gosh, that's a great observation. But let me tell you one more thing about our product. Let me tell you one more thing about the way that our device works. And then you're into it. And now you're just doing this exercise in front of someone else. It's a very, very powerful skill. It'll help you in every board meeting, pitch competitions, wherever you're going to have to talk about your idea, get into a Q&A. This is a skill set that really helps you. So gathering distinctions is how we end this first phase. So we're going to get our ideas out of our head. We're going to climb our family tree and begin to look really specifically at that context, and then that nice slow grilling of our yabbit steak, making sure that we're going to serve up as many distinctions as we can. So now, that's the end of phase 1. So in phase 2, we want to begin to look deeply at these distinctions. So now, we've grilled them up. You're sitting here looking at all these differences. You've got things written down all over the place. Now's the time to step down into the details. So the image I want you to have in your mind is, it's almost like if you were grilling in the backyard and now you're going to go down into the basement. You're going down and you're going someplace that's alone. You're going to go someplace and maybe sit in the dark, surrounded by all these differences. And as you begin to look at that, you're sitting there and you've got your 4 Ds with you. So these are how these are going to play out. You've got lots of details now. There are many of these details that are now expressed as differences over something else that's out there. Just like the example that we gave with pacing the heart versus pacing the gallbladder. From that, you're going to begin to look at distinctions. So some of these differences are really going to jump out at you. And the last one is, you're always going to remember your desire. What was it that you started with? It was to change the way that, gallbladders are paced. And it could be that gallbladder has never been paced. That was sort of our operating assumption whenever we started toying with that idea. So maybe that desire has shifted, because in the middle of doing all this, you now realize there was a much greater need. So always looking back on your desire, what was your intention? You want to be intentional when you're doing this. And it's okay if that intention has shifted, but it's not okay to have your intention shift and then not acknowledge it, because now you've got something else that you need to get out of your head. So maybe you're going to have to go back. But this is the process of sitting with those distinctions. You're sitting with those details and really beginning to understand and absorb what is it that you've got. So perfect time to review our questions. This is why we have that whole thing about Kipling and Aquinas. Questions, getting in and asking those questions. Remember, we are going to be entrepreneurs that ask questions. That was one of our most basic things as we started Diagnosing Innovation. It's all about questioning what you're doing and making sure you answer those questions honestly and receive feedback so that you continue to move forward. Then next we begin to climb up the stairs. And so one of the things I want you to notice here, you're moving upwards, right? So you're starting to come up off of that floor. You've been sitting with those. That was that time of contemplation. That was that time of looking for these differences. But now I want you to notice the difference in the sizes of the steps. When you're stepping down, these are small steps. Each one is a distinction. Each one is just some difference that you grabbed up. But when you're climbing up, you're now doing yes and. And if you've ever watched any good improv group, yes and always carries the story forward. This is not the time for yeah but. Yeah but. Notice how that sort of goes down. Yes and. Yes and is lifting up. Yes and is propelling your story. Yes and is how you combine those distinctions. Yes, and we don't do this. Yes, and our product also enables. Yes, and we can save that battery. Yes, and that data is all of those things that are the distinctions, those differences, and how those matter. So as we come up, we're going to be saying yes and to each one of those. And then that is going to lead you, my friends, to your oh, wow. And that's really what I want it to feel like for you. You've got all these distinctions and you begin to put them together. You should get very excited. It should be, oh, wow. Had this idea, I got it out of my head, I went through this process, it's all come together. This is that click. This is that pop. This is that strike of lightning. Oh, wow. When all of those details now come together and you have now begun to realize you have a story to tell. So that's how the second phase ends, is with, oh, wow. My idea is going to make a great story. So now we begin to look at phase 3. So this is when we begin to see story. And how are we going to tell that story? Well, no surprise, it's the story of your idea. Story is what bridges inside the company to outside the company. Remember when we looked at our business, we had 6 steps to go from ideas to market. Those were things that happened inside the company. We know that there are things that are absolutely going to be private, and then there are absolutely those things that are going to be public. They're unavoidable. You cannot be in the healthcare system and deliver products and not have public scrutiny and not have publicity or have the public looking in. It just won't happen. It's not that kind of an industry. If you want to do that kind of a product, I wouldn't go into healthcare innovation. So we know we're eventually going to be out into public, but we also know that we have this opportunity. There's this time when it's just the people in the company and they're working on story and they're helping to, even telling that story internally, telling that story confidentially, which you will every time you try to raise a round or get money, get a grant application. You're going to be telling this story before it becomes the big public story. So story is that bridge. And then just as I was saying there, we know that there's going to be things that are secret, things that are confidential and proprietary. We always want to be clear about that. Remember, our first rule of the 5 habits is communication. Who are you talking to? Why are you talking to them? And what do you expect to come from this audience? So this is a really important time to remember that, because the work that you've done, remember where we are when we're ready to tell a story. You have got an idea out of your head. You climbed this big giant oak tree. You studied your family tree, your grandparents, your parents, all these other kids. You went down and grilled this yabbit steak. It took you forever to get the charcoal to light, and the meat wasn't, and you had just took so long. And then you sat down there. You sat down in that basement and had to think this out. And then you finally reach, oh wow. You don't want to blow that. Don't blow it now. Make sure that you keep control of your story. It's your story to tell. It's also your story to blow. That's why the first of the 5 habits is communication. This is a fatal error if you get this wrong. So we want to make sure that we're going to tell story, but we want that story to be done with play, because we want to do both kinds of play here. And that is, we're going to play by being kids on a playground, except it's your playground. It's the playground that explains your device or service or whatever it is you're trying to do. This is nothing more than what we do with prototypes, or maybe you invite some people in for a limited study, or maybe you have some test samples that come in and you bring in people and interview them and ask them about it. Those are all those different ways that you're going to set up scenarios where people can play with your idea and play with you and your team and interact with you. And just like kids on a playground, you're going to be there with them. Did you like that? We built this swing just for you. Did it go high enough? Was the seat comfortable? Did you like that we had the little plastic covers on the chain, or do you like to feel the metal? Whatever it might be, but it's the same way of taking your product or service and introducing it to potential people in the market or getting that feedback. You want to have something that they can engage with, and you want to have a way that you can be there with them and get their feedback. And if you need to change the playground around, that's no problem. You change the playground around, just like you'll be changing your device, because you want it to be the place where people will want to interact with it. And if they can't interact with it, or if they're not interacting and having the response that you want, well, then you may want to think about redesigning that part of it, or talking to more people and exploring what's really behind that feedback, which could be unexpected in a good way, or it might be unexpected in a way like, how come we can't get the response we want? This is supposed to be the big hook. This is supposed to be, the reaction that wants them to stop using what they've been doing or what they were trained in medical school. We want them to do our procedure, but it didn't land. Well, now's the time to look at that. And in the same way, the other way that you may play is literally by putting on a play, telling the story of your device, just like I'm doing now as I tell you about diagnosing innovation. You will present your ideas, you'll tell people about it, and you'll have presentations and get feedbacks, or maybe go to conferences or have poster exhibits and begin to get more publicity about that. So This is where you're going to present to these people. You're going to engage with them and, answering their questions or telling them, or maybe providing specific testimonials, or, maybe you've had some data that you can share with them, and you bring in the people that experience that data and talk about the results that they got. And you're also going to react with them, and you're going to react to their questions. But there's going to be an audience, and this audience is going to change. And this audience could be based on, where you are in one of those 6 steps of getting from ideas to being, having your product in markets at scale. So this idea of play is very much like being on the stage. You're going to have to be able to present, you're going to have to get your idea across, all the while considering your audience. Who are they? What are they trying to learn? And kind of looping back to that first habit of communication. So why are you there? What are you trying to tell them? And what do you want from this audience? That's the other kind of play. So just as we talked about before, when we looked at, whenever we're questioning and we want to ask good questions, we want to have that feedback. Here we are again, we've saddled up and we're back at the looping ranch. So we want to make sure that we have feedback. So we're back at the looping That means we want to get feedback from both kinds of play. So this is something else that you'll need to factor in, is how do you receive that feedback? How do you make sure you stay in touch with people and provide them, vehicles for communicating with you to where you can be receptive to that, and making sure that they know what kind of feedback you want. What were you asking for at that particular stage? Whatever part of development that you're in, what kind of information can they get you, and what are you actually looking for from them? That'll help focus their feedback. But you want to make sure that you get that feedback, and then you modify your playground, or you change your presentation, you change the way that you're on stage to present this based on that feedback, and that will just help you to move forward as your story changes. And as we talked about before, the 3 big elements of looping, and the looping you're going to review, going to revise, and you'll renew. Just like you talked about, just like we looked at in the other parts of diagnosing innovation, we're going to do the same thing here, which is to review, revise, and renew each one of the steps in each one of the phases based on whatever kind of feedback you get. And that feedback could lead you to an area where maybe you need to think again about your distinctions. You need to go back and look them over because there was some piece that you kind of got new information. You didn't have to go climb the family tree or grill more yabbit steak, but you got new information, and it made you want to climb back down into the cellar and sit there with those 4 Ds and maybe change the order. So maybe whenever you think about, and a part of it is as you're climbing up from the bottom of the cellar and you're taking those big steps of yes and, yes and, yes and, you're sort of building the rationale of your oh wow, maybe you want to change the order of some of those steps. Maybe the first thing that you started with led logically to an endpoint that didn't quite hit the way you wanted, but as you got more feedback from one of the forms of play, you now realize that everything was fine except for the steps that you used to get to oh wow. Pretty simple change, right? Go back, sit with that information, and then try it another way, and then do it again. Oh wow, here's my story, I'm going to play and get feedback, and then see if that version worked better than the version you had before. So we talked about these 3 phases. To review them, we're going to have ideas that come out in context. We're going to have them be powerfully differentiated because we're going to do that work of stepping down into the details, sitting with our 4D, and then being good improv partners with everybody on your team. Yes and, yes and, yes and, to oh wow, which is going to lead us to wanting to tell our story, and then playing with others in both kinds, and then which is to be told with playful story. So now then, that's the end of the 3 phases. So let's think back to the 6 steps, and we looked at we talked about BMES, right? So biotech, medical, engineering, scientists, those different kind of skill sets. So how do you think that these people will look at each of these steps? Does a person who's really skilled in sort of the pharmacological arts and APIs and drug development and pharmacological interaction with the body, do they get ideas out of their head? Is their family tree the same as I don't know, say a physician, the surgeon, that surgeon that's just, going to figure out how to pace the gallbladder. Will those ideas come out the same way? Will the Yabbit steak be the same that's served by that? What about engineers? How do they get ideas out of their head? And then the scientists. And this is one that I remember the first time I thought of that real distinction. I was teaching a bunch of these sort of biodesign teams. So you have all these different disciplines all trying to work together and sort of learning how to share and how to receive feedback from each other. And I kind of thought of this kind of funny joke where an engineer will do something and have their system and operate it, and it'll be operating this, going through cycles and cycles and cycles, and everything's fine. And 10,000th cycle, everything's fine. The 10,001st cycle, something goes wrong and it breaks. And the engineer says, "Damn, it didn't work." The scientist will run their experiment. So they're running their experiment, they're collecting the data, they're over and over, and they're at the 10,000th time, and everything's the same, and everything the same. And that 10,001st time, something's different. And the scientist says, "Did you see that? Let's do it again." And I'm being, just trying to draw out that difference, that I'm not saying the engineer is right or the scientist is right, but engineers are looking for a different response characteristic in the work that they do. Scientists, particularly there, I'm kind of thinking more about like a biologist or a chemist. You're looking at these large reactions that are not exactly well controlled, but we know generally what's happening. It's one of the things that makes it so challenging whenever we do a lot of assay testing and everything. There's a lot going on, and we're only able to focus on a small part of it. They have a very different lens in the way that they look at things. So now imagine the two of them, those two sort of mentalities, trying to cooperate on a team. This is what I'm trying to draw you into with this one. And the data scientist is looking at this saying, I can't do anything with this. They did this 10,000 experiments and then I can't do anything with this. What do you mean? I did it 10,000 times. Yeah, but you had no discipline. There was no calibration. There was no synergy in what you collected. And the data you did collect is meaningless. It's not really related to what really matters. It's not related to the oh wow in some way that's going to drive the product forward. So you can see that each different skill set is looking for a different facet of the product itself, and that background that they bring is a different lens that they're going to look at this. So this is one of the areas that I think it makes it very challenging to work in a really complicated industry like healthcare or any of our regulated industries because of all those disciplines that have to come together, which is one of the reasons why I have been trying to make this, this series of talks, which are agnostic to the background that you have, but instead try to use images, try to use playful ways, or remind you of childhood, or sitting around waiting patiently or impatiently for some made-up fictitious fish to cook. But that's what you're going to have to do as you work with other people in a very, very large and complicated system where you're trying to deliver a new innovation. And then in each one of these, do their details matter? And do the details matter the same to every one of them? And they all have to share in the same oh wow, but do they see, is the wow to them the same as the one to, again, what's wow to the data scientist may not even be, kind of raise the eyebrows for the wow for the engineer or for a physician that's helping out. So I think that it's really important to understand that there's a wide range of perspectives. All of them are important. And if you think about who your audience might be at any given time in the life cycle of your company, there might be a time whenever you've really got to play to that particular part of the audience that's going to be looking for that flavor of wow to move the needle and keep them interested in your company. So then finally we start looking at, is this just one story? Do we have one story to tell, or are there many, many chapters in what will be more like an adventure book for you? And then I put there at the bottom, those are our 6 steps, right? Ideas turn into products, products get evaluated, and then ultimately get approved. You figure out how you're going to get payment, and then you're releasing those into markets, and that begins to scale your business. So that's, that's, I think what you'll find, and what I invite you to think about as you begin to go through this year and begin to look more closely at innovation within healthcare, is there the same story in every phase? Are you going to be telling the same story when you're talking to a value committee at a hospital? So payment, you're looking at payment. Is that story going to be the same? Will the wow for a value committee be the same as the story you'll need to tell to FDA? The wow for FDA, that you're safe and efficacious? There's a whole lot of things that they're going to care about, and many of them may not be what you think they are. And so understanding those audiences and how your story needs to relate to those audiences, and still making sure that you have that wow. I'm not saying make things up, but I'm saying consider your audience. First rule, first habit we talked about is communication. That's your audience. Why are you talking to them, and what do you want out of this? And if you want FDA approval, you better be talking and thinking about that audience. So I invite you to consider that as you're looking at these areas, that your story is probably many stories, or it's one story with many chapters, and that each one of those will be tailored more likely to appeal to an audience that lines up with one of the 6 pathways that we're going to have as you go from idea to scale. And then I have to tell you, I thought I would be remiss if I did not tell you that today they are having the 24 Hours of Le Mans. It started this morning, so it would have been about, 7 a.m. Pacific. They started, so while we were doing this, there are drivers there in France that are heading towards midnight of the first day. And this reminded me of, I watched Formula One when I was a kid back in the 70s, and there was a film that came out by Ron Howard called, it just went out of my head. Anyway, it was a racing film, and it looked at Niki Lauda and one of these early races, which kind of really brought back that memory. The film's called Rush, and it brought back a lot of memories from watching Formula One when I was a kid in the 70s. And so this was also at a time whenever I was really finding that when I was back in Boston giving talks to these cross-functional teams or university-backed innovators and all this, that I was having a lot better interaction, and it was easier for me to express things when I went to the those big crazy blackboards with the chalk that's about 2 inches in diameter, which is huge fun if you've never done that, and you can throw the board and it goes up really high. We always seemed to have some classroom at MIT. But I started thinking more about that. Why was that? It was because I was using images. I was remembering something from my childhood. But now I was looking at it through a different lens. And so the reason I bring that up today is that it's really, you think about a matter of racing innovation. And as you reflect back on diagnosing innovation and the 3 sessions we've had today, and you're going through this year, I want you to kind of remember this too. This is what I'll close with this, and we can have some time for Q&A. So when you think about racing innovation, first off, there's drag racing. And you've probably seen this: huge engine, giant rear tire, little tiny front wheel, hard to steer, very, very fast. But doesn't have to do much, but go in a straight line. So it's really point to point, very fast. So the second one I want you to keep in mind is what's going on today, which is the race at Le Mans. Le Mans is all about endurance. It is the same track, but they went from the afternoon into the evening. They will drive all night. They will then drive as the sun is coming up. They'll drive through the morning all the way through to the following afternoon. 3 drivers, 1 car, a team of engineers, and the people that are monitoring them. And there's a lot of rules about what they can or can't do with the car, but that endurance, same track, 3 people, shifting them out, and trying to make sure the car makes it for 24 hours. Can you sustain performance for 24 hours? And then finally, the third one to keep in mind is Formula One. Now, Formula One is the same team, but it's different tracks. So they have to go all over the world. So they'll race one weekend, and then it's sometimes during the race, like this weekend they're off because of Le Mans. But most of the time, they're in one country, and they're racing that Sunday. They got to box everything up, get it on a plane, get it to another country, which is sometimes very far away, get into that time zone, adapt to the temperature, get on the track, go through the practice, race there. and then box it all up and do it again. And another country in another 5 days' time. So what I want you to remember with this is that just like racing, there are going to be times when you're going to need to sprint. You've got to be a drag racer. The only thing that matters is from A to B. Early stage prototyping, fail fast forward, all of those are images of drag racing. Right now, maximum effort, point to point, straight line. What happened? You crossed the line. How long did it take? Can we do it faster? When you think about Le Mans, that's going to be when you're collecting data, a clinical trial, going through a phase 3, trying to keep everybody enrolled, trying to make sure that we're all there, we're getting all the data, everything has to happen. Those are examples of the endurance. And then when we think about scale and going into one market after another, that's the example of Formula One. Even if you just want to try to penetrate the United States, it's not one market. Each one of the regions, all the health centers are divided up by regions, just going between the differences between each of the states. That could be very much like a Formula One race. It's the same car, it's the same product, it's the same team, but each time you have to go into that new market. So that's the example of Formula One. Same team, different market, week after week, pushing it through. Okay, that's all I had. So I will stop there and take any questions that you guys have.
I'm not sure I can see it, but Eileen is here, one of the cardiologists here, one of the Biodesign Accelerator fellows. Thank you. This is very, caused a lot of self-reflection. And in your experience, or what are your thoughts on when do teams and companies fail the most? Is it in the early phase when or is it just, at what point do you think things tend to be the most difficult for the team that thinks they have the best idea or the best design? And what are your what's your advice on? I know we talk about the feedback loop, but in terms of doing it internally, and more importantly, doing it externally to people who will be critical to your idea and to your thoughts on what your greatest invention is going to be.
Yeah, I think the one of the things that's always very important is to we talked about self-knowledge when we looked at the 5 habits, that a lot of times when you're starting out, and for a lot of you, I really encourage you to think more about, and this is the same thing that I say to the Stanford fellows when I work with them, which I have for many, many years there. I think that the one consistent message that I always deliver is that it's much more important to me that you spend this year thinking about the process of having ideas, and you want to have that idea all the way down to an endpoint. And remember, even if there are gaps, even if everything is not perfect, because the failure mode will vary, but a lot of times it's more, you think about the way the SEALs look at that, right? It's fail fast forward, right? So that's another sort of the spirit, and a lot of the things that I've been talking with you about is that idea of learning from what's out there and then modifying your behavior. We looked at the OODA loop, right? So you're going to observe, orient, decide, and act. It's much more important to me that you learn how to do that, because that response rate that you have and the ability of the team to come together and to look at things and then react to them, that's really, to be honest with you, that's really the chief failure mode. The chief failure mode is one of the inability to bring together the different skill sets that are already native to the team without, just no way to bring that together and to bring forth, what the different aspects and different talents are that everyone that's already right there with them. At the same time, there's also that unwillingness to admit that they don't have all the skills they need and that they need to bring an outside expert in. So I can't give you a generalization about when they fail or how they fail, but I do think that's, if I had to look at a common denominator, it's really a human factor. And a lot of what I've tried to do with this entire series that we have is to really accentuate that. We use a very, very simple and basic business plan. I know that I'm not trying to be an adjunct over at Anderson and lay out a business plan. It's something that's very simple about a business process that's actually quite complicated, but it's enough for you to see from end to end, and then to have those habits that will allow you to be receptive to others, and then a really playful way of looking at your ideas and accepting feedback. And I think if you can do that, then your failure mode might be different, but it won't be one where you just couldn't hear the feedback that this is not going to work. And a lot of times that's a big failure mode, is that they weren't hearing the people around them. They were saying there's no way this product is going to go forward, but they'll in some sort of mistaken sense of grit, they press on with something that's actually already terminal, but they just couldn't hear it. So maybe my answer is, the reason I made this up is that I'm trying to address what I see as the chief failure mode, which is really a human factor failure mode.
Thanks, Ben.
This is Jan Skowronski, interventional cardiologist. If I may ask a question, Ben, you eloquently described the 3 stages. In your opinion, who are the people who would help you most and people who would hurt you most?
So for the folks that are inside of UCLA, you're really the beneficiary of a lot of the foundational work that Jennifer and Desert have done. So you will have access to a wide range of different parts of the UCLA system, including UCLA healthcare, and then other people within sort of the greater ecosystem around UCLA. So you want to start with that. That's almost like you think about the friends and family, and those are the ones that are really on your side. They're really there to see you succeed, and there's nothing adversarial about that. I think so I think the first part is realizing where are your friends and family, where are the people that are where are your allies. I think what gets dangerous is sometimes entrepreneurs will get out over their skis, and I think going out to business plan competitions or pitch contests, and because again that's why the first habit is communication. So kind of holding back and maybe not telling story too soon. I recognize that there will always be a time when you have to get that out there, and you do ultimately have to raise around. But I think that people are maybe not doing as much as they can internally before seeking external resources. And then when you do reach out, I think it's important to find that subject matter expert. I know this week you have been hearing from a lot of those different folks. When we looked at the 6 steps of the business, we looked at Q&A and ClinReg people and what I called heroes, the people that do health economics. So there are subject matter experts that are in these other areas. And so I think in the early days, finding those experts and bringing them in, even if it's a little early for when they might engage, they can still give you insights that will help you. And I think that's probably the safest way to go. I think what's really dangerous is at a very early stage, when you haven't sorted things out, to go out and begin talking to venture capitalists or to begin talking to potential investors or seeking angels, because that almost necessarily will lead you to giving out more information than perhaps you're really ready to. And again, as we looked at in communication, you're going to give a lot of information out. You may not get the response back that you want.
Hi, Ben.
Hey there.
Thank you for that talk. I think we have time for just maybe some closing remarks, but I want to let you know that our fellows and folks in the room are kind of kicking off on what we call a 10-day innovation sprint. And so we're kind of asking them to go through the motions of the biodesign process in a very segmented, defined time frame to help advance and potentially de-risk a concept here that's addressing aerosol-related droplet transmission here at UCLA. What advice might you give them for proceeding on what would be typically done over the course of the year? We kind of want them to run through at once in this accelerated time pace. How does this work when you really have to speed up the pace?
Well, I think I would encourage you to use the materials that we looked at in my 3 talks, and maybe it was fortuitous that we looked at a matter of racing innovation, because you're not necessarily going to deal with sort of Le Mans and F1. You'll want to really be focused on the drag race, and maybe thinking about using that drag race idea with that early stage. And I think here my my big encouragement to you would be to really zero in on this first phase, and as fast as you can, your 1.0 and your idea, get up that tree. And it sounded like, Jennifer, I heard you right, aerosol transmission mode for COVID. Yeah, I love that. It was very funny. There was an article in Time magazine that came out. One of the guys, a researcher in University of Colorado, who is, public health, and has always said, there's really these three big transmission modes, and we just kind of got stuck for almost 100 years with, two primary modes, and no one really was listening to this body of information about aerosol. And this was whenever this, it's very funny, we now have to number the wildfire. So not the most recent wildfire, but the wildfire that preceded the set of wildfires we're in now. So in that set of wildfire, we were just having a lot of the smoke settle in. You could literally see the air, but you couldn't really see, it was like you could tell there was something there, but you couldn't really tell what it was, but nobody doubted that that was bad. And it was like within a day or two of me reading this article thinking, oh my gosh, that's really it. If it is an aerosol, that is the mode. It's just like smoky air. You would never dream of going outside in that. And so it was something that really stuck with me. So explore that more. I do think that it's a rich area, and at least based on that paper, not taken seriously or not understood. So you may find that, one of the first things you're going to have to do is figure out for yourself, how well do you understand it, and how do you study it, and where can you study it. And so I think going back and looking at, remember our Kipling questions and Aquinas questions, why and how, and then having your 6 honest serving men. But I would focus in this first stage. This is very much what this is for. Get that idea out, find that context, get it on the grill. Yeah, but what did you find? What's different? What just like, no way, that's not the way it works. I can't believe that's right. Whatever those, sort of radical findings are, and just go through that process as fast as you can.
Thank you, Ben. I'm just, as you were talking today, as we're counting all of our past conversations in my head, and I just now realized the running thread of yeah, buts and yes, and. So it finally clicked for me today. So there's something at least.
Yay!
But thanks to you for joining us, and I hope to see you again virtually or otherwise soon. And thanks to Jan for listening in as well.
Yeah, and Jennifer, don't forget, sometimes it's depends on what lane of the pool you're swimming in, or whether or not you're climbing a palm tree.
I'll leave it to the fellows to figure that one out, but does all relate to a previous discussion that
Yeah, licensing. Swimming in the lane is about licensing, and a palm tree is, if you look at the way palm trees grow, maybe this is a good one to remember too, for your sprint. The way palm trees grow is that it's really like a radial tire, and they kind of grow like this, but then it all comes into one branch. So that idea of merging together something that's really at a cross, which is actually very, very strong, and then as it comes together, it forms that one branch. So there's only a few thousand palm trees in LA. So next time you're going by one, take a look at it. You can see it on the base. You can see the bands. It really reminds me of the way that the spinal cord is made, and the annulus there. It's just a big radial tire that holds your spine together. So anyway, that's palm trees and swimming lanes.
And orthopedics. Thank you.
There you go. All right. Bye now.